This is Chapter 17 of State and Local Government course, looking at social welfare and healthcare policy. Social welfare policy is where a typically democratic society is trying to take care of its people, whether it's through health care or assistance in various programs. So we're going to talk about those, particularly at the state level. And we'll also focus a little bit more on healthcare, since that is a pretty big expense of state and local government spending, and costs are increasing. One of the things that Americans have to deal with is poverty. That particularly since the recession, poverty has increased a little bit. About 14% of Americans are living in poverty, and that rate has basically changed very little since the 1970s. There was a big effort in the 1960s to lower the poverty rate, which was extremely high, as much as 28-30% in some states. But since that time, it's fairly leveled off, has not changed much. And in any capitalist type system, inequality is going to be a byproduct of that. We also see that inequality in America has been increasing, and the United States has the highest inequality of all industrialized countries in the world. So there's things that we're dealing with here that where the assumptions that we had from the 60s are becoming somewhat outdated, as far as relative food costs are higher than they were back at that time, as wages have stagnated, particularly since the 70s, and it's hard to get real numbers. Official numbers potentially understate the actual number. Looking at the current poverty rates, it's 23,000 for a family of four, a little under 12,000 for an individual. And these numbers are pretty big for a country such as the United States. 45 million in the U.S. live in poverty, and 20% of all the children in the United States live in poverty. And the varies from state to state. Mississippi, for example, has 22.4% of its population living in poverty. The political views on poverty are somewhat divided, and this typically contributes to the polarization or the gridlock in government to try to attack these problems. Conservative view is generally that poor are victims of their own deficiencies in a free market society where the individual is considered responsible for their own success or failure. That is more of a conservative view, and the government would not want to interfere with the free market. And morality issues such as lack of marriage, lack of individual responsibility, those are some of the ideological views on poverty from the conservative side. On the liberal side, generally looking at poverty as more of a structural, systemic problem, which includes things like discrimination, racism, lack of opportunity, being born into a transgenerational situation where there's very little social capital, and that dysfunctional families are a part of that, as well as inadequate education. So those are the political divides over dealing with poverty. Now, as far as looking at the history of welfare policy, it all kind of starts particularly with the progressive era in the late 1800s. Even by 1890, the biggest budget item in federal government was Civil War pensions. Great Depression of the 1930s was a big turning point in that there was a lot of people that were hurt by the Great Depression through no fault of their own, and the United States was somewhat behind other industrialized nations in trying to take care of the elderly or the sick or the poor or the out of work. So a lot was done during the New Deal policies that we talked a little bit about in that progression of federalism. In the 1960s, 60s was a very progressive decade as far as attacking several problems, whether it be women's rights, civil rights, environment, pollution, and Johnson's policies were deemed the Great Society, where a lot of effort was taken to alleviate poverty. Also, the Medicare and Medicaid systems were created during the 1960s as well. The 1980s, we've already talked about in that timeline on federalism, is that there was a kind of a pushback against the more regulated federalism and therefore giving more back to the states. So those reforms were trying to address some of the behavioral dependencies, leaning more towards a conservative free market policies to try to address these dependency issues, and continues on through the 90s where more power is given back down to the states to work out these welfare to work programs to try to put time limits on being on welfare. So that was part of the devolution that we talked about during that era, where the states were granted a little bit more power to take care of some of these issues as they saw fit. However, the money's still coming from the federal government. So let's look at some of the various types of welfare programs. Public assistance can be delivered as direct cash transfers, such as temporary assistance to needy families. This is actually what we refer to as our welfare program, which was part of that reform back in the 1990s. Here, we're given 2 years to find a job, and 50% of the recipients are working part-time, so that was part of some of the reform to try to eliminate some of the dependency on welfare. Supplemental security income, SSI, also referred to as disability, and particularly during the recession when people's benefits run out, such as unemployment and still having a hard time getting work, disability has been subject to abuse where somebody might be able to get qualified through some ailment, regardless of how bad it might be, in order to get some public assistance. And then the earned income tax credit typically goes to families with children, tax refund to the low income in particular there. Another form of public assistance is called in-kind programs, which is where the assistance is given in the form of that service. For example, food stamps, which is called Supplemental Nutrition Assistance Program. This is where people are given vouchers to be used for food. And during the Great Recession, there was quite a big spike in that. That has come down somewhat. Medicaid is another in-kind program where if you qualify low income, you'll get medical insurance assistance there, and that is paid by the state and federal government directly to the medical providers. That's why it's called in-kind. Jointly funded, we'll look at some of the numbers here in a minute, and it's a pretty big chunk of state budgets, as we'll see here in a little bit. And the Affordable Care Act, in order to try to get more people insured, put some more qualifications on the states and added 3 million new recipients to the Medicaid program. More in-kind programs includes SCHIP, which is health care for children, and the Affordable Care Act also boosted the federal match to 93% to incentivize more states to do that for children. There's also various housing programs such as Section 8, which provide rent subsidies to low-income people. And there's also other child nutrition programs, school lunch programs, Head Start to get kids into preschool type programs. Another type of welfare program is what is called social insurance. Social Security being the largest federal expenditure. Even though the Social Security was designed to be only a supplement to your savings, we see that almost 1/2 of people over 65 rely strictly on Social Security for their income. And Medicare is also a an entitlement provided to people over 65. That's 20% of the federal budget. That's health insurance for the elderly, unemployment insurance for those who are out of work in order to provide some sort of stopgap to provide uh, vital assistance in between jobs, that sort of thing, and to spend on basic necessities, which also helps the consumption factor of our capitalist system, and being on that as long as 59 weeks. Current programs generally that long. Workers' compensation is another social insurance type program to help people that are hurt on job related accidents. Here's a very useful table that shows the number of recipients in millions of people that are on these programs. And as you can see, this is somewhat of a misperception when people talk about welfare. Well, the people actually on welfare is a relatively small number when you look at the other millions of people that are on these other programs, such as SNAP, food stamp program, Medicaid, S-CHIP, and Social Security, Medicare. Considerably more people on those programs. And as you can see, we've talked about before, the federal government funds most of these programs. Medicaid is funded both national and state funding, as well as a couple of these others, such as Medicare. And as far as who administers it, we see this is where it's been devolved down to the states, where the states have the power to administer these programs here, even though the funding, most or all of it, may be coming from the federal government, as you can see on these right here. And then as far as the total expenditures, obviously the biggest tickets there are the Medicaid, Social Security, and Medicare expenditures there. Now the welfare traps is what the book describes as what people may get caught into receiving assistance and have difficulty getting out of that. And of course the conservative viewpoint is part of this as well, that it creates dependencies, and that could, by getting this money, it could reduce incentive to find work, and also see that community service that could be part of this welfare system could displace low-wage workers, and children that qualify for assistance, because we could actually consider children a public good in our society. So helping them is a clear priority, but by helping them would also enable parents who may be on the welfare system. Another paradox is deadbeat dads who are not providing support for their kids, and by putting them in jail, that prevents them from working to support their kids. And we see that the vast majority, well, close to majority of the poverty is, well, about 40% of people in poverty are single parent families headed by women. So the working mothers, they provide for their children as far as when they're being at work there. Some of the goals that are somewhat common to all states is looking at the well-being of children, as we talked about, as well as whether it's conservative or liberal who are calling the shots here. The goal is to try to reduce the dependency on any type of social assistance. So that means looking particularly at single parent families and what is the best route to handle them. We see that 40% of infants are born to unwed mothers, which are already putting themselves into a low-income situation for the most part anyway. We see that the males are overwhelmingly the non-paying parents. So these are some things that could be targeted in order to try to achieve these goals. And that daycare, which of course is one of those issues that working mothers, if they have to get a job and pay to raise their kids, what do they do with the kids? So therefore could do some partial funding of daycare through the TANF program. More on public assistance goals, looking at teenage mothers, we see that the rate has decreased, but again, most births are out of wedlock, so that results in the potentially for being a single mom. And we've already mentioned how most of them live in poverty, so that's exacerbating that situation. And back to the conservative versus liberal goals, we see that trying to teach abstinence is somewhat difficult as compared to dealing with the socioeconomic factors of needing assistance, and also some other controversial elements out there in that the debate over abortion will continue for a long time, and certain laws prohibit Medicaid from funding abortion, which could add to more unintended consequences and social costs over and above that. So that's what you've got to look at, cost versus benefits of funding some of these types of programs, and how to deal with any moral opposition on that. On the welfare to work programs, we're looking at work first strategy, in that job search is always a high priority there on the welfare program, and looking at trying to implement more long-term benefits through job skills, through education and training, to hopefully prevent people from getting back on welfare. Again, the private versus public argument here, where even nonprofit firms could be contracted to administer these types of programs. Probably quite a bit more room for a nonprofit sector to handle some of this type of administration, but not yet proven effective. Particularly privatizing it has been consistently kind of ruled out because of the need to make a profit off of helping somebody in need of help. And we also see that part of the conservative pushback is that some states are requiring drug tests to qualify for certain welfare programs, and the submitting to treatment might be part of a qualification in order to get the assistance needed there. There's also, as far as long-term benefits, potential, because we already know that since almost half of Americans don't really save anything to speak of and have to rely on Medicare and Social Security, so there might be some incentive there for individual development savings accounts. And what a lot of these goals sometimes conjure up are fears of what is called a race to the bottom, where states are cutting benefits in order to save money, and therefore maybe pushing poor to other states that have more benefits or better benefits, and could lead to a lack of jobs if people are leaving the state, and more homelessness if people are going to other states. And then the big question, as we've talked about throughout this class, is how does federal involvement play into this? That's something that states have pretty much been tasked to take on this responsibility, but how much more federal involvement may be needed. Now let's talk a little bit about healthcare, because the costs of healthcare have been rising incredibly over the past couple of decades and are still rising. Lots of ideas out there to try to lower healthcare costs, but the United States has got the highest healthcare costs of any country in the entire world by far. 18% of the U.S. economy is spent on healthcare, and that's risen dramatically from what it was back in the 60s, when things like food and housing were your biggest expenses. Now healthcare is one of your biggest expenses in your budget. And what's wrong with this picture, of course, is that despite the fact that the United States spends so much on healthcare, our costs are so high, we are not anywhere near the top in any of the major health factors, particularly longevity and infant mortality. These numbers have actually dropped a little bit. We're probably somewhere around 30th in the world in both life expectancy, longevity, or child mortality, the number of children dying before age 2. Medicare pays for a big chunk of the aging population, and of course that is part of our social insurance program, but because costs continue to go up and up and up, that just means the federal expenditures are going to go up and up and up because the federal programs just have to pay what those health costs are. And Medicaid is already at about 20% of states' budgets and will continue to increase as well as long as health care costs continue to go up. So what are some of the reasons why we have increasing health care costs? Now, behind all of this, of course, is the idea that healthcare does not fit the normal supply versus demand mechanism, because people will always get sick at some point, and if health care costs go up, people still need to pay those, and so therefore there's no incentive in that way to keep them down, so costs can just keep going up. But our population is aging, so that just means we have more people that need health care. We also see that America is one of the most obese countries in the world, particularly of the Western industrialized democracies. This is just a stat here that might have just one of many examples of why we might be, because 43% of children 5 years old drink at least 1 soda per day. The United States has the best technology, no doubt about it, but that also makes it the most expensive technology, and it may be used when it's not necessarily needed to be used. For example, an MRI costs approximately $1,200 in the U.S., but only about $360 in France. C-section is about $3,700 in the U.S., but only about $600 in Canada. So those are some pretty dramatic differences in costs there. As we talked about, healthcare costs are not market-driven, but profit-driven, so that's why costs can keep going up. Touched on the unnecessary treatments that could be cut back. And we also see that because Medicare is required to pay, there's quite a bit of fraud and abuse in the Medicare system. Overpayments to Medicare could be as high as 25% of costs. And this is just one of hundreds of examples. A nursing home was caught giving a 91-year-old woman 30 pills per day that she didn't need. So the administrators have been caught numerous times overcharging, overbilling. So there's just lots of things in our healthcare system that could be looked at to bring costs down. But the general idea is that being profit driven, it will continue to go up. 25% of Americans who are less than 65 have no health insurance, and so that results in our lifespan being shorter because we're not taking care of ourselves as much, as because of the health insurance provides preventative maintenance. And we also see that the emergency rooms are going to be clogged by people who have no insurance. 50 million people who are working are uninsured, so that's showing how a lot of businesses can't afford to provide health insurance for their employees, so therefore more and more free services are attempted to be used, and what that does is that escalates the costs for the people who are paying insurance, because we're having to pay for people that don't have insurance. And also we see that it's not sustainable. So this is another challenge that you will have when you get out there into the world solving problems. The average retiree will pay $140,000 in Medicare while at this point receiving $430,000 in benefits. So obviously that's not sustainable. So costs are going to have to come down, or something's going to have to get a hold of that. Fixes are difficult because there's lots of powerful entities that like the status quo, such as hospitals, insurance companies, drug companies, that spend a lot of money in campaign contributions and lobbying in order to try to maintain their benefits. And as I've said before, until the United States, as a general rule, thinks of health as a public good, then it may never be able to get shifted over to some other alternatives, or even incrementally shifted in order to try to bring costs down and get more people insured. Because as more people are insured, the health of this society improves in general, which has enormous social benefits in the long term. Some more stats on Medicare and Medicaid. 40% of Medicare is consumed by just 5% of recipients, mostly in the final weeks of life. Some of that's not going to be able to be avoided, so there's going to be some decisions that would be made, particularly on the personal level, that might reduce some of those expenses. But again, if the costs are high, expenses are still going to be high. Almost 40% of Medicaid spending goes to provide nursing home care for seniors who've exhausted assets, many of them former middle class. So this is where, once your benefits run out, then if you're on fixed income, then you would potentially qualify for Medicaid. So therefore, you're just shifting from one public assistance program to another. And we see that as far as preventative maintenance goes, a lot of Medicare costs are from people entering old age with weight and health problems. So therefore, keeping yourself healthy throughout life would lower these costs in the long term, rather than just having costly drugs to keep unhealthy people alive. So that's, those are some hard decisions to deal with there, as far as lowering healthcare costs, making society a little bit more healthier in general. Here's some basic terms that you've probably heard. Managed care, that's just a term. We're looking at several types of health plans that are seeking to contain costs. Managed competition is generally what the U.S. has tried to do, to have market-driven insurance plans so that they can compete and keep costs down. But as I've said before, healthcare does not really comply with that supply versus demand competition model, and prices can keep going up. Portability is which may be getting better, but this is where individuals can take health care coverage with them wherever they go, and that's still very difficult to do. Single payer system is where you're trying to put all the administrative costs into one agency, and while this is critically called socialized medicine, it is still pretty much the norm in several other countries that seem to be very satisfied with that. So it's just another option to keep down costs, particularly administrative costs, by putting them all into one entity. And universal coverage is particularly when we're looking at some of the Democratic candidates that are talking about a comprehensive health coverage plan to all citizens. That certainly might be a long-term goal. It may also need to come across incrementally in order to try to get to that situation, because there's a lot of people on private insurance plans that are happy with that. So it might be part of a mix as we go forward. Now, the states are trying to deal with health care by expanding coverage, particularly to children and low income, and Medicaid, of course, is part of that. And so converting Medicaid to some of these other managed care programs is part of what states are looking at doing. Some states are coming together to pool their funds in order to try to manage healthcare costs. And then the public-private collaboration is something to where the public entities could contract out or partner with private companies in order to try to provide, so that could potentially keep down costs as well as provide effective service. And universal coverage, which you've already talked about, where and this is part of what Affordable Care Act had tried to do, is that in order to incentivize people to get insurance, that you are subject to fines by not being covered, and that's called the individual mandate, which then got shot down in the recent tax bill. So looking at rankings of the states as to which states are the healthiest here, some of you may even be looking at paper topics on something like this, and you could kind of look at what makes some states healthier than other states. And again, we start to see patterns here where the Southeast seems to be predominant in certain aspects here, particularly in this case, the least healthy. We already talked about Mississippi, Alabama, and West Virginia also having a relatively higher poverty rates, and so New Mexico also relatively high poverty rates. They have some correlations there with healthy or less healthy. We also see that some other challenges are facing us. Drug prices continue to increase. They are awarded patent monopolies when they come out with a new drug, which allows them to charge extremely high prices for those. So that's something that clearly the governments would have to pursue that if they wanted to bring those costs down. We also see that nurses are one of the jobs, as well as doctors, that are facing shortages in the future because of the increasing need for health care, and because of the fact that we have been using antibiotics for so long, and perhaps even over using antibiotics, we're starting to see new bacteria resistant to some of these antibiotics and having to come up with new ones. Nursing homes are getting taxed. There's also, as far as people needing nursing home care, and just handling people results in problems that are going to arise. And the United States does not have universal coverage, so that might add some questions as to why is the resistance to that. As far as the Affordable Care Act, we've already touched on this. The ACA was trying to incorporate various state innovations and make them nationwide. We already talked about how expanded Medicaid coverage as a condition of accepting the 90-10 subsidy. Some states opted out of doing that, particularly more conservative leaning states. And one of the problems with that, of course, is that if you take on more, then states may eventually have to pay a larger share of the costs, which means they have to come up with revenue sources for that. Now, here are some internet resources for the social welfare policy and healthcare policy.